name is Seth K from the Center for Thyroid and Parathyroid Surgery, and in this video we will be discussing primary hyperparathyroidism. Now, most people are familiar with the thyroid gland. This sits low in the neck, just above your chest plate, and it looks like a little butterfly. Its role in the body is to produce a hormone that helps to control metabolism. Now, less people are aware of its neighbors, the parathyroid glands. There are 4 of these, 2 on each side of the thyroid. These are very small, like the size of a rice grain. These sit on the surface of the thyroid. Their function is completely different from the thyroid, which is to help control calcium levels. Now, calcium is very, very important in the body. It helps keep our bones nice and strong, helps our muscles to contract, keep our heart in a normal rhythm, and allow our brain to send messages throughout our body via the nervous system. Because calcium levels are so important, the concentration or level of calcium in our blood needs to be kept in a very tight range. If it gets too high or too low, bad things start happening in the body. The way we prevent those bad things from happening is all 4 of those parathyroid glands are constantly measuring calcium levels in the blood. If they ever dip below a certain range, the parathyroid glands will recognize this, and they will make a hormone called parathyroid hormone, which will help to increase the calcium back in the normal range. So if we measure calcium and parathyroid hormone levels, or PTH levels in the blood, we will notice that they have a balancing or teeter-totter effect. Calcium levels go up, PTH levels will go down, and vice versa. This balancing or teeter-totter effect has been going on since the day we were all born. Now, for reasons that are no fault of your own, sometimes one or more of those parathyroid glands will lose its ability to measure calcium levels in the blood. Subsequently, you would always think that calcium levels are very, very low, even though they're normal or even elevated. And as a result of chronically thinking that the calcium levels are low, it will make lots and lots of PTH to compensate. In order to make more and more PTH over a long period of time, that small rice-sized gland will get bigger and bigger and bigger and form something called a parathyroid adenoma. Eventually, with chronically elevated PTH levels, we will see that the calcium levels will rise as well. So we will lose that teeter-totter balancing effect. When we see that the PTH levels and calcium levels are elevated in the blood at the same time, we make the diagnosis of primary hyperparathyroidism. Now, why are we concerned about this problem? There's 3 main reasons. Number 1, our bones. One of the main ways that the PTH increases the calcium levels in your blood is it starts to steal calcium from your bones. This can lead to thinning of your bones. Early stages of this are called osteopenia, late stages are osteoporosis. And if nothing is done about this problem over a long period of time, you can form very brittle and fragile bones with a higher risk of breaking them. Number 2 are our blood vessels. When we have chronically elevated calcium levels in the blood, your blood vessels can calcify and sometimes even narrow. This can increase your risk of developing high blood pressure and even having a heart attack or a stroke. Lastly are our kidneys. Our kidneys work as filters for the blood in our body. And if there's anything in excess in the blood, the kidneys try to filter that out through the urine. And in this situation, they're trying to filter out higher levels of calcium in the blood. As this is being filtered through your kidneys, it can sometimes lead to kidney stone formation and sometimes even kidney failure. So for those 3 main reasons, your bones, your blood vessels, and your kidneys, when we find this problem, we want to fix it. Now, there are other symptoms that can be associated with primary hyperparathyroidism. We refer to these other symptoms as non-specific. The reason being other medical problems can cause the same symptoms, so sometimes it's hard to tell who's causing what. These symptoms include feeling tired, poor sleep, difficulty concentrating, aches and pains in our bones and joints, and frequent urination. If you're experiencing any of these symptoms, there's no guarantee that they will resolve the treatment for your primary hyperparathyroidism, but there is a chance. Now, unfortunately, there's no way to cure primary hyperparathyroidism with a medication. The only way to truly cure it is to find the bad parathyroid gland and remove it with the surgery. 85% of the time, it's 1 out of the 4 parathyroid glands that's bad, 10% of the time 2, 5% of the time all 4. Because of that variability, sometimes this surgery can be a little bit challenging. As surgeons, we've come up with several ways to help simplify this surgery. The first is trying to find how many bad glands you have and where they're located ahead of time. That allows me as a surgeon to make a much smaller decision, focus where I need to be, avoid risk where I don't need to be. Also allows for a quicker, less painful recovery for you. One way we do this is looking with an ultrasound. The reason being on ultrasound, a normal parathyroid gland is so small, again, the size of a rice grain, that we can't see it on an ultrasound. But oftentimes the enlarged parathyroid adenoma can be visible on an ultrasound. And this is something very simple that I can perform in the office to try to find where your parathyroid adenoma is. We also look in another way, either with a 4D CAT scan or a sestamibi SPECT scan. These scans allow us to see in your body from your jaw all the way down to your chest, and also deeper in your body, deeper than an ultrasound can. This allows us to see parathyroid adenomas, which can be located in what we call ectopic or abnormal locations, which is very helpful to anticipate or expect prior to your surgery. So between the ultrasound and either the 4D CT scan or the sestamibi SPECT, we can usually again find where your parathyroid gland is and how many you have. The second thing that has helped us as surgeons is our ability to measure your parathyroid hormone levels in the blood. Our extensive research and experience tells us that if I've cured you, if I've removed all your bad parathyroid glands, your PTH levels, which have been elevated, will drop into the normal range within 10 to 15 minutes, which is really cool. So during the surgery, after I remove your bad parathyroid gland, but while you're still asleep, I measure the PTH levels in your blood. If we see that they drop into the normal range, we know that you're cured. If the PTH levels do not drop, indicating that you're one of the rare patients that have more than one bad parathyroid gland, I still have the opportunity to search for those other 3 parathyroid glands while you're asleep and find which ones are bad and guarantee that you're cured before we wake you up. So that concludes our video on primary hyperparathyroidism. For more information about primary hyperparathyroidism or parathyroidectomy surgery to cure primary hyperparathyroidism or any other topics on thyroid or parathyroid issues, please visit my website at sethkmd.com. That is SETHKAY.md.com. Thank you very much for watching.